Imagine going to a doctor for a headache, and instead of giving you medicine, he drills a hole in your skull, or having hemorrhoids treated with a red-hot iron, or being told the best cure for your illness is drinking your own urine. These were not torture methods. These were real medical treatments. And today we're looking at the most terrifying cures in the history of medicine. And number 3 on this list is something some people still do today. Most of us complain when medicine tastes bad. That awful cough syrup, the giant antibiotic pills, the weird minty flavor throat spray. But compared to what people used to endure for treatment, modern medicine feels like a luxury spa. Today, if something hurts, you walk into a pharmacy and there's probably a pill waiting for you. Headache? Covered. Allergies? Easy. Heartburn? Done. But for most of human history, medicine wasn't based on careful research or controlled trials. It was based on guessing. And sometimes those guesses were horrifying. Doctors experimented. Patients hoped for the best. And very often the cure was worse than the disease. Here are 8 of the strangest and most terrifying medical treatments humans have ever tried. And by the end of this list, you might never complain about cough syrup again. 1. Chloroform. Today, chloroform has a dark reputation. Movies usually show it being used by villains to knock someone unconscious. But in the 1800s, doctors saw it as a miracle. Before anesthesia existed, surgery was a nightmare. Patients had to stay awake while doctors worked with knives and saws. The pain was unimaginable. So when chloroform was introduced as a way to put patients to sleep, it spread quickly through hospitals. Its popularity skyrocketed after Queen Victoria used it during childbirth, which convinced many people it must be safe. Soon, chloroform was used for surgeries, childbirth, and even battlefield operations during wars. But there was one problem. People started dying. Some patients simply never woke up. Doctors realized that chloroform could suddenly stop the heart, and the number of unexplained surgical deaths began to rise. Eventually, its use declined as safer anesthetics were developed. But for a time, one of medicine's greatest breakthroughs was also one of its biggest risks. 2. Eating human remains. Yes, this really happened. For centuries in parts of Europe, people believed the human body itself had powerful healing properties. So they started using it as medicine. Powder made from crushed human skulls was sold as a cure for headaches and epilepsy. Ground-up Egyptian mummies were consumed to treat various illnesses. Even fresh human blood was believed to have healing power. In some places, people would gather at public executions with cups in hand, hoping to buy blood from the recently executed. The logic behind this practice was simple and disturbing. If a disease affected a certain part of the body, then consuming that same body part might heal it. Head problems? Eat skull powder. Blood disease? Drink blood. By modern standards, it sounds unbelievable. But for hundreds of years, this was considered legitimate medicine. 3. Urine therapy. Another strange treatment came from something the human body produces every day: urine. Across several ancient cultures, urine was believed to have medicinal benefits. People drank it to treat conditions like asthma, arthritis, allergies, and stomach problems. Some even used it as a mouthwash or rubbed it onto their skin. Roman dentists reportedly used urine to whiten teeth. And strangely enough, this idea didn't disappear with ancient history. In the early 1900s, a British naturopath promoted a practice he called urine therapy. He claimed that drinking your own urine could cure numerous illnesses. He even said he once completed a 45-day fast, consuming nothing but urine and water, despite scientific studies showing no medical benefit and several health risks. The practice still exists in some parts of the world today. Needless to say, most people prefer modern medicine for malaria as a treatment. In the early 1900s, one doctor came up with an extremely unusual idea. He believed infecting patients with malaria could cure another disease. The doctor was Julius Wagner-Jahreg, and he was studying patients suffering from advanced syphilis, which often caused severe mental illness. He noticed something interesting. Some patients who develop high fevers from other infections seemed to improve mentally afterward. So he formed a theory. Maybe the intense fever itself was killing the bacteria responsible for the disease. His solution? deliberately infect patients with malaria to create those high fevers. After the fever weakened the syphilis bacteria, doctors would treat the malaria with medication. Shockingly, the method worked in some cases, but it was extremely dangerous. Some patients recovered. Others died from malaria itself. Despite the risks, Wagner actually received a Nobel Prize in medicine for this work. Just a few years later, penicillin was discovered, making the entire treatment unnecessary. 5. Curing rabies with water. Rabies has terrified humans for thousands of years. One of its most disturbing symptoms is hydrophobia, an intense fear of water. Victims develop painful throat spasms that make swallowing almost impossible. So when doctors in the past saw patients refusing to drink water, they came to a strange conclusion. They believed the patients simply needed to be forced to overcome their fear. Their solution was brutal. Rabies patients were sometimes submerged in water, sometimes repeatedly. The idea was that exposure to water would somehow break the fear and flush the illness out of the body. But the doctors misunderstood something critical. Rabies patients weren't afraid of water psychologically. They physically couldn't swallow it. The treatment often resulted in drowning. It didn't cure rabies. It just killed the patient faster. 6. Trepanation. Imagine having a headache and your doctor deciding the solution is to drill a hole in your skull. That practice actually existed. It's called trepanation, and it's one of the oldest surgical procedures ever discovered. Archaeologists have found skulls with carefully cut holes that date back thousands of years. In many ancient cultures, people believed mental illness or strange behavior was caused by evil spirits trapped inside the head. So doctors or spiritual healers would drill or cut a hole into the skull. The goal was simple: let the spirit escape. Surprisingly, some patients survived the procedure based on evidence of bone healing. Today, modern surgeons still open the skull in certain situations, such as relieving pressure from brain swelling. But the tools, techniques, and anesthesia used today are far safer than anything ancient healers had. Back then, it was basically skull surgery with primitive tools. 7. Heroin as medicine. In the late 1800s, a pharmaceutical company in Germany introduced a new drug. They marketed it as a safe, non-addictive medicine for coughs and respiratory illnesses. The drug was called heroin. At the time, doctors believed it was actually safer than morphine. Pharmacies sold it in syrups and tablets, and physicians prescribed it to treat coughs, bronchitis, and even tuberculosis. But doctors soon noticed something troubling. Patients were becoming extremely addicted. Heroin turned out to be far more addictive than anyone expected. By the early 1900s, governments began restricting and banning its medical use. What was once advertised as a harmless medicine quickly became recognized as one of the world's most dangerous drugs. 8. Red-hot iron for hemorrhoids. The final treatment on this list might be the most terrifying. Hemorrhoids, swollen veins around the anus, are extremely common and usually harmless. Today, they're treated with creams, medication, or minor procedures. But in ancient medicine, doctors took a far more aggressive approach. One method involved burning the hemorrhoids off with a red-hot iron. Yes, exactly what it sounds like. The heat would cauterize the swollen tissue. Ancient physician Hippocrates, often called the father of medicine, even wrote instructions for performing the procedure. According to his method, assistants were supposed to hold the patient down while the iron was applied. The goal was to burn the tissue until the problem disappeared. Of course, this also caused severe burns and unimaginable pain. Compared to that, modern treatments suddenly seem very appealing. Medicine has changed dramatically over the centuries. What once involved guesswork, superstition, and terrifying procedures is now guided by science, research, and careful testing. So the next time you complain about swallowing a bitter pill or drinking unpleasant cough syrup, just remember, at least your doctor isn't trying to cure you with skull powder, malaria, or a red-hot iron.